Hi, I'm Stephen Jones. At Robert Wood Johnson, we believe citizens need to be informed about the important healthcare issues affecting their lives. That's why we're proud to support the healthcare programming produced by the CAUCUS Educational Corporation.
This special edition of One-on-One with Steve Adubato is brought to you from the Tisch WNET studios at Lincoln Center. Funding has been provided by Wells Fargo, the New Jersey Education Association, United Water, making the planet sustainable is the best job on earth. Robert Wood Johnson University Hospital, the heart of academic medicine. The Robert Wood Johnson Foundation, New Jersey Sharing Network, dedicated to saving lives through organ and tissue donation. And by Choose New Jersey. Our mission is attracting companies to the Garden State. Promotional support provided by NJ.com. Small news, big news, True Jersey. And by Commerce Magazine.
This is One-on-One.
When you first heard that they were doing Charlie Rose and Gayle King, didn't you go, what?
People like laughing at others, so I don't mind if the other is me.
See, you go right into the character. That's what it is.
I'm bringing families together a half an hour each week. Man, I'm doing something special.
And so I do feel successful.
We're pleased to welcome our friend Bob Marino, Chairman and Chief Executive Officer, Horizon Blue Cross Blue Shield, New Jersey. Bob, good to see you.
Good to see you, Steve. Good to be here.
We fully disclose, and we want to fully disclose that you are a member of the board of public television in the state of New Jersey. But we're not here to talk public television. We're here to talk about the changing landscape of healthcare. But we often talk about we're moving from what was called fee-for-service to a more, quote, patient-centered care model. And I'm asking myself, haven't we always done that? Or what's different? Talk to us.
Sure. Well, you're right, Steve. What we're doing and what Horizon's committed to doing is really changing the way healthcare is delivered and paid for in the state of New Jersey. Today, healthcare is delivered and paid for in New Jersey, as it is throughout the country, on something called a fee-for-service system. And as the name suggests, the way the reimbursement works, the services or more services you do, the more reimbursement you collect. Fundamentally, it's not a sustainable economic system. So we need to move to something that creates more value for the healthcare dollar. So Horizon is very committed to transforming how we pay for and deliver care from fee-for-service to what we call fee-for-value. So people will always ask me, well, can you define value? What does that mean? So we define value three ways. The first way we define it is that we have better outcomes and improved care. The second thing is we have more patient involvement, better patient experience with the delivery of care. And third and importantly, we're able to lower the total cost of care. So when we talk about transformation, we want to move from this unsustainable fee-for-service system, which basically does not provide coordinated care. Essentially, it's an inflationary kind of system, to a system that rewards value. And again, value being defined as better quality, better outcomes, better patient experience, and lastly, lower total cost of care.
Bob, it makes sense, logical, but I'm asking myself, what does it mean, what could it mean for patients on the other end of this?
It's a fair question, and here's what it means from our perspective. Number one, patients will receive better care, more coordinated care.
What does that mean, more coordinated?
More coordinated care. Today in our fee-for-service system, care is delivered on a very fragmented basis. I'm certain you know of stories of folks who see one physician orders a series of tests, see another physician, and another series of tests are ordered. Uncoordinated, fragmented care. So when we talk about patient-centered care, we're really talking about a primary care physician, a family care physician, coordinating all of the needed care for that patient, ensuring that the patient's getting the care in the right setting, at the right cost, at the appropriate time. Importantly, when a physician practices what we call patient-centered care, they act as sort of like the coordinator of the overall health care for all of the patients in their panel, if you will. And instead of just going in to see the doc because you've got, an acute bronchitis, your doctor, when he or she's practicing patient-centered mental care, is really looking out for your total well-being, making certain that you're getting the right preventative care at the right time, et cetera. And as we're able to transform the delivery system to do that, patients will see improved care, more involvement with their care, appropriate care at the right time, at the right place, and importantly, lower total cost of care because services are being better coordinated.
The other thing is I've done a lot of leadership development, coaching at Horizon,
Yes.
so I've gotten to know your people a lot. And one of the things that your people tell me is that one of the challenges they face is communicating a lot of what goes on in health care and health insurance to the average consumer. How much of this, frankly, is a product of communication and breaking things down so the, quote, average consumer can get it?
Steve, you're right on point. I think one of the biggest challenges that we have in healthcare, it's a very complicated, complex business.
By design?
Well, healthcare is a lot different than, if you will, manufacturing number 2 pencils. It's a lot more complicated, if you will. And I think one of the challenges we have is that we speak a totally different language than the average consumer. And I think the challenge for us and other organizations in our business is we need to speak a different language, need to make it simpler, less complex for members and consumers to understand. When you talk about concepts like patient-centered care, you know, folks say to me, are you talking about nursing homes? No, we're really not talking about nursing homes. So there's a lot more work we need to do to really communicate the message, simplify the message, and make the end consumer, the user of healthcare, really understand what we're talking about when we talk about transformation of healthcare.
I'll tell you what, go back to how you started this conversation, the economics. One thing everyone understands is when you can't pay for things. You said the system, fee for service, is not economically sustainable. Please help us understand that again. Why is it not sustainable? Why can't we just keep doing what we're doing?
Well, because to be honest with you, when I talk to employers, I talk to small business people, I talk to individual families and consumers, and they find out what I do for a living, the first thing they will tell me is, we just can't afford this. It's too expensive. What are we doing about controlling the cost of care? And fundamentally, we need to change the system. The system of fee-for-service is a system that grew out of perhaps World War II when employers first started offering health insurance coverage. And by design, if you listen to the words fee-for-service, it means the more services I do, the more fees I collect. It's not producing the value that we need in healthcare.
Excuse me for interrupting. The more tests ordered, the more I get paid. Doesn't work.
Doesn't work. It's not sustainable. You know, New Jersey, unfortunately, is probably one of the states with the highest cost of health insurance and certainly one of the highest cost of health insurance premiums. Some of this is driven by the fact that the current system of fragmented delivery of care, which we have through the fee-for-service system, simply isn't sustainable. When we look at medical inflation, here in New Jersey, medical inflation probably runs somewhere between 5 to 6% a year. Compare that to general inflation that runs a little over 1%. So even though people talk about, well, the rate of inflation in healthcare is coming down, it's still a big number when you compare it to the overall consumer inflation. So we need to fundamentally change the economics in healthcare. We need to move healthcare more towards a value-based system where reimbursement is based on the quality of care, the outcomes that are produced, the patient involvement, and then lastly, lowering the total cost of care.
The reaction you've gotten, you were talking to our news anchor, Mary Alice Williams, about some of these issues, and one of the areas that you started to get into, I want to follow up on, is the reaction you've gotten from the others in the healthcare community, more specifically, not just the physicians, but the hospitals. On board?
Clearly they are. You know, we're really excited about the work we're doing. For the last 3 or 4 years, we've been collaborating with key physicians and hospital organizations. We now in New Jersey have the largest network of patient-centered medical home physicians. We have over 6,000 physicians that are involved in patient-centered medical care delivery. We also have a series of what's called accountable care organizations and episode of care. These are very new, innovative payment models of how we pay physicians in hospitals that really puts the focus on the quality as opposed to the volume. Results, we're very encouraged by what we're seeing. For example, we did a study in 2014 based on 2013 data. We took 200,000 of our customers that are getting care through patient-centered medical homes, and we compared them to 200,000 comparable patients who are not getting care through patient-centered medical home. And the initial results are encouraging. For example, we saw for the 200,000 people that were getting care through patient-centered medical home, 14% improved rate of diabetes management, 12% improved rate of cholesterol management, 8% higher breast screenings, 4% higher screenings for colorectal cancer. So the indications are positive. When you look at some of the cost metrics associated with this, we found that those 200,000 members in patient-centered medical homes, 4% less visits to the emergency room, 2% less admissions into hospitals, 4% overall lower total cost of health care for these 200,000 members compared to 200,000 that are not in patient-centered medical
That's optimistic.
very optimistic. We're encouraged. We're encouraged. We're committed to this. It clearly is the strategy of our company to lead the transformation of healthcare from fee-for-service to fee-for-value over the next 3 to 5 years.
Bob Marino is the Chairman and Chief Executive Officer of Horizon Blue Cross and Blue Shield of New Jersey. We'll continue this conversation as this transformation in the healthcare world continues. Thank you, Bob, for joining us. We appreciate
Steve, thank you. Thanks for having me.
Stay with us. We'll be right back right after this.
To see more one-on-one with Steve Adubato programs, visit us online at steveadubato.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato PhD. And follow us on Twitter at Steve Adubato.
There she is. Paula Franzese is the author of A Short and Happy Guide to Being a College Student, also the Peter W. Rodino Professor of Law at Seton Hall Law School. Good to see you, my friend.
It is wonderful to see you.
Now, we had you on our sister program, Capital Report, with my colleague, Raphael Pierman, talking about ethics and corruption and politics. Not this show. This is a conversation about being a college student, A Short and Happy Guide. Why did you write this book?
For my son, Michael. Michael was starting Boston College a few summers ago, and Steve, he's my oldest, and I was anxious. I was very anxious about his being away from home for the first time. And as an academic, I started to do what I do best. I started to write. So I began writing.
You didn't do a letter a day, did you?
I truly did. And this kid has a heart of gold, because I started in June, and by the middle of August, 2 weeks before he was about to pack up and leave, he had about 120 letters in a box on his desk. And he finally came downstairs and he said, "Ma, why don't you just write a book?" So I figured I would take that in a good way, so I wrote the book.
And so here's the thing. We take what you were going to give to Michael exclusively, and we expand it to every other college student. So I got to ask you, the 3 most important things that every college student should know if they really want to be happy and successful as a college student, what are they?
Number 1, remember who you are and where you come from. Every one of us stands on a legacy of virtue and honor and sacrifice and compassion and faith, and most essentially love. Remember that. We suffer when we forget. We start to stray when we depart from the essential moral compass that's inside of each of us. Number 2, be careful of your digital imprint. Take good care with social media. Know that nothing gets erased. The anonymity of virtual world is an illusion, and it also can encourage bad behavior.
Stay on that.
Yeah.
Why do you think so many young people, particularly in college, make that mistake of thinking, I need to be out there, I need to, in their minds, be relevant, and they do and say such dumb stuff?
I think part of it is social norming. I think because everyone is doing it, somehow it becomes acceptable. It's not. I think as well, the bar has just been lowered and lowered and lowered. The way that we approach each other, the language that we use, our rhetoric is less than civil in so many ways. When you add to that anonymity, the idea that you're no longer face-to-face, let alone identifiable by what you're writing, or seemingly anonymous by what you're posting, then you've got a combustible situation. What people write in a comment section online, I would dare say, is not what they would say to someone face to face.
What does that have to do with college, though?
In college, so much of social media is really a contradiction in terms. It's not very social. You're with a laptop, you're behind a screen, you're not with someone face to face. So the temptation is great to chime in the chorus of people trying to shame someone else. All of us is better than that. And the real mission is to try to be the aspiration as opposed to join a very tattered fray.
That was 2. Your third piece of advice is?
The third is be of service. The only way to really find meaning is to serve. And the surest way out of suffering is to help someone else out of their own. So I always encourage my kids, particularly when they're down in the dumps, do something for someone else. And there's a whole neuroscience that backs us up on this. Our brain's joy centers light up when we commit to compassion, to altruism, to generosity. So on a Saturday when my son calls me from Boston and says, "Ma, I'm kind of down today. I had a rough night. I got rejected. Things didn't go as I had hoped. One of my friends kind of shut me out."
Yeah,
I
kids
tell
get
him
blown off a lot by
all
other kids.
the
It
time,
hurts.
Steve. Kids can be mean. I tell him, get to the food bank, get to a soup kitchen.
That's what you tell him.
All the time. And Steve, for sure, he always, to the extent he listens, comes back and goes, "Ma, you're right."
Our 12-year-olds, 10, 12-year-olds come back and we'll talk about the same sort of thing, and I'm thinking, first I get mad at those other kids and I go, that's not a solution. What are you going to do? Why can't they just accept my kid? But that's not it sometimes.
Right.
You're saying, don't get caught up in that, get caught up in helping someone else.
Right, that's exactly it, Steve. The antidote to meanness is never more of the same. And I always tell my kids, if you've got to convince someone to see your worth, if you've got to disabuse someone of some harsh preconception, don't extricate yourself. Remember, again, who you are. We're also very faith-based in our family. I'm a devout Catholic. I believe that the good in some of us can be the good in all of us. And I believe that sometimes we need reminders of what's most essential. And I believe that you got to walk the walk and not just talk the talk. And that by committing to service, you're reminded of a certain humbleness, of a certain compassion, and of the fact that it's really not all about you anyway. There are seas of need in a larger world, and we don't do everything, but we can do something.
Real quick, how's Michael responded?
Oh, very, very well. I'm so proud of him. He just graduated last week from Boston College.
Congratulations.
He'll be going to law school
What was it
in
like
the
for you?
fall.
He's going to law
Proudest
school.
moment, yeah.
What was that whole thing like for you?
The proudest moment. Commencement, my heart burst. My parents, I knew, were very proud of me. I'm the first in my family to graduate from college, let alone law school. And my dad, I remember him crying, and I said, "Daddy, what's the matter?" And he said, "It's tears of joy, it's tears of joy." And I didn't quite get it until last week. I cried tears of joy for my son. It was a pride like no other.
Finally, what is it about us and our kids?
I think
We live and die with them.
I think that that's the hallmark of good parenting. I think that's it. When my Michael was born and when Nina was born, my sister reminded me, just get them all saturated in the juices of love. Just let them bask in that love. I think it's the surest recipe for success.
The name of the book is Being a College Student, A Short and Happy Guide to Being a College Student. And Paula Franzese is not just a great professor of law at Seton Hall Law School, has been teaching and motivating and inspiring young people for a long time. She's a great friend of public television. Thanks, Paula.
I adore you. Thank you so
Same
much.
here.
Thank you.
Yeah, thanks for saying that. We'll be right back right after this.
To see more one-on-one with Steve Adubato programs, visit us online at steveadubato.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato, PhD, and follow us on Twitter at Steve Adubato.
We are joined, pleased to be joined by Lynnette Khalfani-Cox, who is the author of College Secrets, How to Save Money, Cut College Costs, and Graduate Debt-Free. How are you doing?
I'm great. How are you?
I'm great. Is this possible? Is this really possible?
Not only is it possible.
By the way, before you go any further, I want to say you're co-founder of
.com.
AskTheMoneyCoach.com.
There you
Thank
go.
you very
Yeah.
much. Always
That's
branding.
right.
I love that.
Good deal.
Is it possible to do all this?
I think that not only is it possible, I'm living proof that it's possible. I made a claim in this book, and it came out at the end of 2014. So this was before my own daughter, who's 17, who's about to go off to college in the fall, was accepted to any schools. But I made the claim that if you follow my tips in College Secrets, a family could save anywhere from $20,000 to as much as $200,000 over the course of a 4-year education. We're about to do just that. My daughter got $40,000 in aid from her school that she'll be attending.
Right.
She got an out-of-state tuition waiver, which is one of the things I'm really pushing families to learn about how to get those. She got scholarships through the Business Honors Program. She had fly-in visits where the school flew her out there, so it wasn't on my dime. So we saved a ton of money. I'm tallying it all up. It's about $175,000 thus far over her 4 years.
But
that
don't
we
you
know
think
we've
the
saved.
key to saving all the money is having you as a mom?
She lucked out, no doubt about it. I think
She
she
had the
lucked
gene
out.
pool going here.
Well, you know, it's great for a parent like me who's going to be a little bit of a helicopter parent and who pushes and who, you know, advocates. But a lot of it is just knowing and doing some of the heavy lifting, and that's what I did for
Let's do this, because we're seen in the tri-state area, but we're based in New Jersey. Can we talk college cost in the Garden State?
Right.
Now, I graduated from, my undergraduate graduated at Montclair and State, and then it was a college then. Now it's a big university, which a euphemism for we charge more. So, and then I did my graduate and doctoral work at Rutgers, which was pretty affordable at the time. And no disrespect to my friend at Rutgers, it ain't cheap anymore. Even the public state-funded schools are not cheap. Talk about it.
Well, Rutgers, as you know right now, is about $25,000 all in when you look at tuition, fees, room and board. Needless to say, folks who are coming from out of state, they're paying a little bit more than that.
They should be.
But, well, they should be, especially because the aid is not there, as you know, as it had been in years past.
Right.
That's right. And that's one of the things that's driving costs. If you look at the trends over the last decade or so, we've seen tuition go up almost 25%. And that obviously has far outpaced people's incomes, which have been stagnant or even falling.
Right.
And so because we've seen not only rising tuition prices, but housing creeping up, books and supplies creeping up, all this stuff, everything has gone up. You're seeing a lot more families with their students coming out with debt. And that's a big problem. Debt is up about 40% over the past decade. And it's crazy when you look at the numbers. It's about 1.2 trillion with a T in student loan debt outstanding right now.
Do you believe that, in fact, sorry for interrupting, do you believe that, in fact, college debt is the next major financial crisis this country is about to face?
I don't believe it's the next. I believe it's already here. We just
How bad is this? And don't just do the numbers,
right?
Because people can't relate to the millions, billions, trillions. They can't. They don't put the number in context.
Well, let me tell you what they can relate to.
Go ahead.
They can relate to the fact that student loan debt is holding back an entire generation. They can relate to the fact that the typical 20-something is saying, can I afford to get married? Can I afford to take on this job? Do I need to get a high-paying Wall Street job when really my heart is that I want to be a teacher or a social worker? They can
But
relate.
I can't because
I
can't
pay off
pay my
these student
debt.
loans.
Right.
Yeah, so I have to get a high-paying job. It may not be what I really want to do. They can relate to the fact that the student loan debt is holding people back from becoming homeowners, and a lot of millennials are like, look, I got to pay off this debt, this credit card debt, this student loan debt, before I can think about achieving that part of the American dream, becoming a homeowner. So people can relate to the practical day-to-day. The people who are 30-something, the people who are 40-something like me, you can relate to the fact that I had student loan debt when I got out of school. I had $40,000.
You had 40.
$40,000 in student. It took me over 15 years. So I'm determined that my kids are not going to have student loans. And indeed, my daughter, the first one off to college again, just, you know, in a couple months, she's not going to have any student loans. But it's, you know, if you don't really know some of the strategies and kind of even what to ask for, you just be kind of hanging, you know, blowing in the wind.
Let's do that, because my strategy has always been, because we have 4 kids now,
God, yeah.
but 2 marriages, all the way from our 22-year-old who graduated from a great college and now is going to, he just said to me, Dad, I want to go to graduate school, and I just saw the numbers there. Somehow I'm involved in that.
You almost fainted, right?
Yeah, but now I'm involved in that conversation. I'm not exactly sure how that happened.
Well, you know New Jersey law, I won't even get into all this, but New Jersey law is that, you know, parents are supposed to pay to support their kids. Even, you probably heard about that famous case where a girl sued her parents.
Yeah, I know.
And the kid's right to support extends to a parent's obligation to pay for college. So, you know, you can talk about whether that's graduate school.
No,
I don't want to talk about that, but I'm just saying.
But I'm just saying also we have a 10, 12, and a 4.5-year-old. So here's my point.
Behind.
You got the college savings plan going.
Yep.
But here's what doesn't match up. I got the college savings plan for all the kids.
Right.
But then
529 plan?
529.
Perfect. Yep.
But here's the problem. I'm looking at your stuff, and you talk about not just tuition. You say, Steve, forget about that. Audience, forget about that. Why don't you also add on to that other fees, parking fees, internship fees, tuition differential fees? What are you talking about?
Right.
Let's break it down.
Right. So this is the thing that I really want your viewers to know. When most parents and students, frankly, think about college costs, they typically think about what I call upfront college costs.
That was what I was saving for.
The tuition, the fees, the room and board, the books and supplies. That's the stuff, right?
That's right.
Well, in College Secrets, I talk about dozens of other expenses, what I call hidden costs that most families are totally ill prepared to pay for. They don't even know about. Tuition differential, you mentioned, for example. This is a big one right now. Here's what this means. If you look on a school's website, say of Rutgers, say Montclair State, whatever college you take your pick, if your kid is going to major in something in the humanities, English, you know, history major, social studies type of thing, the sticker price that you see, most people don't pay sticker price because they can get a scholarship, they can get a little tuition discount. But in general, the price that you see is for those majors or in liberal arts, stuff like that. If your kid is a STEM kid in science, technology, engineering, and math,
go ahead.
If they're in the arts, if they're in nursing, they're going to pay a surcharge.
More?
Yes. They pay, so anything, photography, drama, nursing, absolutely.
I don't see that in the advertisements. I don't see that.
Of course
in the college advertisements.
That's in the fine print. That's after they've got you there. You know, there's always the hook in the fine print. The hook is what reels you in. The fine print is the sort of gotcha.
And that's the differential.
That's right.
Internship. Could you talk to me about parking fees?
Yes.
I found out my college was like $500 for parking fees.
Nationwide, the average college generates about $635 per parking space. They're getting about $4 to $5 million a year in this. I actually did some homework on this just before I came on the show. You know, Rutgers, Princeton, they're in the low ballpark, believe it or not, about $200 or so.
Schools?
For the much more. When you look at places like Stevens Institute of Technology, some kids can't park on campus there anyway because, you know, space is at a premium. Those who do park off campus, they're paying about $105 a month. So $900+ over the course. Leave that car at home. Take mass transit, carpool, use those ride-sharing car services, that kind of stuff. A car is a huge money drainer for any kid who's at school,
I'm gonna plug the
here
book.
or away.
Lynn, I'm going to plug the book. That one more question. College Secrets: How to Save Money, Cut College Costs, and Graduate Debt-Free.
That's right.
I call it the Ivy League Harvard syndrome. All my friends think they have to send their kids to the best.
I know.
And then they graduate. They got $100,000-$200,000 debt.
I know.
If you want to say, listen, if your kid can get in and you want to do it, you should do it. That's great.
But
is it ROI, return on investment?
I don't think it's there, frankly. I think that there are so many great schools in this country. We have over 5,000 schools in this country, but we have over 2,500 four-year institutions that are in the not-for-profit sector, you know, not the for-profit colleges.
Right.
You have a ton of great choices. My daughter got accepted to UVA, UT Austin, NYU, Virginia, you know, just Fordham, a whole bunch of. She ultimately chose UT Austin. I'm very happy.
Right.
#3 program for marketing in the country. She's going to do great. But really, she would have done well at any of these schools. You don't have to have that mentality like Ivy League or bust. Because the kids who are performing at that level, if your kid doesn't get into, say, Princeton, which is our Ivy League school here in Jersey,
I got rejected
would that
too.
person do just fine at another really high-level school? Absolutely. So don't think that that's
Some
the
of
case.
us went to Rutgers and we're still working.
And you're doing just great.
Well, in some people's eyes. Listen, Lynnette, I want to thank you so much for joining us. You're terrific.
Pleasure.
Make sure you come back again.
I definitely will.
All the best. Great guest on One-on-One.
One-on-One with Steve Adubato has been a production of the CAUCUS Educational Corporation, celebrating over 25 years of broadcast excellence. This special edition of One-on-One with Steve Adubato is brought to you from the Tisch WNET studios at Lincoln Center. Funding has been provided by Wells Fargo, the New Jersey Education Association, United Water, Robert Wood Johnson University Hospital, the Robert Wood Johnson Foundation, New Jersey Sharing Network, and by Choose New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.